things from inside the circle. We invite you to join us in finding your tribe, finding your purpose, finding your circle.
Hello, and welcome back to the Circle podcast, where we are discussing the aspects of the self. I'm Ryan Green.
And I'm Sharon Mackey, founder and CEO of the Circle of Women, Inc. We are so glad that you joined us today. And we know that we have some great nuggets that we're going to be able to share. We have a wonderful guest who's going to be joining us, and Ryan's going to tell you who that is.
Of course, but first, today we're diving further into the circle to talk about the realities of mental health. We've covered self-love and how to pick yourself up, but it's important to understand how mental health affects someone.
Yes, I think that this is an on-time topic because I'm looking around and I'm seeing so many people in need of mental health assistance. It has really grown in proportion. I don't know what our world is going to do about it. And so I, as a psych major and a professional myself, am interested in trying to assist people that are in need. There's so much depression, there's so much anxiety, and people are really starting to express it outwardly, and we're all impacted by that. So I think this is a good topic to talk about, and I'm so excited to hear what our educator has to say about it on today, because we need to get the word out to the masses. We need to let people know what is going on and what options they may have, or just some nuggets to carry them through the day.
Yeah, and there's starting to be a rise in discussion about mental health in my own generation, and I think that's because of a rise in depression as well in my generation that I've noticed. And so today, our guest has extensive education in clinical psychology, earning her doctorate from Chicago School of Professional Psychology. She's a licensed marriage and family therapist and the founder of Forms of Expression, which helps provide emotional outlets to kids from the age of 7 to 17. To give us a deeper insight on mental health, we welcome Dr. Arlice Cleveland. Hello, Dr. Cleveland.
Hello, hi.
Hello, Dr. Cleveland. What a pleasure it is to have you here today. We are excited because we know that you've got some good information that you're going to share with us on today, especially in light of everything that has been going on in our world, even with the political realm and sickness and illness. Depression is just on the rise. So this is perfect timing. So thank you for being here with us today.
Thank you for having me. Thank you for having me. I look forward to being here.
Great, great. Ryan's got a few questions she's going to pose to you today, and then we're going to just kind of dig right in.
Yeah. So my first question is going to be, how can one acknowledge where they're at mentally in order to accurately deal with what they're going through?
That question is, that's a really great question. But I think that mental health is continuous. It's like you always have to be aware and alert when it comes to mental health. Yeah, we do have situations that happen, such as like what we had the voting, politics going on, we had COVID going on, right? There was a lot happening, and not to mention there were many who passed away. So as a residual of that, you still have family members that are still suffering from that, still experiencing grief and so on, right? So basically what it looks like is mental health is, it's a continuum. It's a continuum. And to always be mindful of mental health, it shows up not only through depression, anxiety, grief, etc. Nonstop. Yeah.
Yeah, I agree with you on that. That's true. Do you think though that we should always make it a lifestyle to receive therapy? Like it's part of our daily living to be in therapy?
I think so. Absolutely. I think so. Every day we're it's like your mind is taking in so much, your energy, your emotions, right? So you go to
Hmm.
work, you're working continuously, like you go to the dentist regularly, you go to the doctor, right? So it's the same
Yeah,
for your mental health. If you don't have your mental health, if you don't have that together, then you're lost, literally.
that's so true. That's
So
so
always being mindful of self care. Self care is a part of your mental health.
taking care of oneself is very, very vital to our daily living. I you talked about grief and loss. Grieving the loss of a loved one is wow. Sometimes it's something you just never get over. Um, how would you tell someone or share with someone some nuggets that they could use when they're dealing with the loss of a loved one?
Well, it's definitely speaking to, I would say for sure going to therapy, but um, being around loved ones, those that really care for you, not listening to sad music, watching sad movies, um, just being mindful. Like, okay, if you're listening to something sad and you're watching something sad, where's that going to take you? It's only going to take you down, right?
That,
And
yeah.
memories, right? So it's actually being around others that are supportive and loving. There's no time limit on it, so it's being mindful of that it's okay to cry, it's okay to grieve, it's okay to write in a journal, it's okay to just feel like I just want to go someplace where I could just scream if I need to, but allowing yourself to be and allowing yourself to be active. And sometimes it is okay just to be still, and not all the time do you even have to have someone to tell you something, or to give you advice. It might just be just to be there with you, just to hold your hand. It's okay to ask, can you just be here with me? And go from there. But
And I
mental
think sometimes just
health.
sitting in silence, right, and not even
Mm-hmm.
talking. Somebody can be in the room with you, and just sharing that space is enough to bring you peace, right?
Right.
Yeah.
Right.
Today I was talking to a group of individuals about alcohol use and drugs and why we sometimes go to that. A doctor
Mm-hmm.
can prescribe you a med, and then that med can cause you to want more meds. And before you know it, you're doing meds and drinking and you're doing all this stuff, and it spirals out of control. And it all started with a mental illness. It all started with something that you were going through that, you had a hard time coping with. So, what do you say about coping skills?
Coping skills, it goes back to self care, okay, and learning tools and attending therapy. One of the great things about therapy is having the ability to work, having someone to work with you, to teach you tools and to go through a process with you so that you can learn special tools like mindfulness, meditation, um, also um, different forms of, they have like Tai Chi, just different ways of helping you to be able to cope. And there are various ways. I know that you mentioned substance use. Substance plays a major role in it as well, and it can
Mm-hmm.
it can lead to mental health issues, even if it's not vice versa, the other way around, right? So being mindful of that, feeling sad, feeling depressed. Someone could be in a car accident or have a slip and fall, or something can majorly happen, and now you're prescribed medication for, let's say, 3 or 4 months, right? Pain medication, and taking that medication, and you're taking it as prescribed originally, right? And then when it's time, they say, oh, well, you're better. And now you're off that medication, and here you go. It's like, wait a minute, now I'm going through withdrawal symptoms, right? And
Yeah.
so I try to go back and get some more, and they're like, no, you don't need any more. So, and that's bad, because then they end up going someplace else. And so now you're not only feeling stressed and depressed, right? Not to mention the other factors that fall in, because if something has happened, most likely your job is being affected, it's affecting family, loved ones. So there's a full realm there, and being able to attend therapy is really important. It's good to be able to talk to others that can speak to you and talk to you, but it's best to speak with a professional, to really have a professional as well, because many times others, they're supportive, but you want to be able to speak with a professional that can help you clinically as well with that.
I like that. I like that. Ryan, what do you think?
I do like that. And I was just about to ask if someone isn't able to like go out and seek therapy. I know you said that talking to loved ones would help, but if they're not comfortable with the idea of being vulnerable with the people near them, how would they go about expressing that the emotions that they're feeling?
You mean with a therapist or finding a therapist?
Yeah, if they're not able to contact a therapist or speak with a therapist, and if they don't feel comfortable speaking with the people around them, how would they go about kind of making sure that they're okay?
Mhm.
Yeah, that's a really good question. One of the things about therapy is a person would have to want it, right? They have to want it. And if they're hiding, basically, because that's what it is, it's kind of hiding, isolation. That's all a part of the depression. That's all a part of that anxiety. And eventually, they would have to get to a point where they have to reach out to somebody, even if it's a pastor, a priest, someone that will care for them, that can see that they're suffering. You know, um, isolation it shows up. Uh, Even if a person is around a whole bunch of people and they're just quiet, somebody's going to look. Somebody's going to say, "You okay up there?
You
Right?
okay? Yeah. Yeah.
You okay?" Some kind of way. And so it would be up to the person to eventually give some type of indicator, that there's something happening. Unfortunately, when someone isolate or stay to themselves, or then it's just like what Ms. Sharon said earlier, it lead to other situations, using, self-harm, suicide, something, but there's always an indicator.
That's interesting too, because I noticed in dealing with the populations that I serve, I'm finding that there's always a dual diagnosis. Um,
Mm-hmm.
Things that have been going on for a very long time, and they've been going on unaddressed. And so what
Mm-hmm.
happens in that case, you may have been molested as a child, or you may have been slow in school, or there could be any number of things that could have happened to you. And then as you begin to grow older, you've had these things in a compartment, and those things start to show up in your life, and you're trying to figure out, how did I get here? How did this happen? And I notice that a lot of Black families or people of color, they tend to decide that we're not going to get therapy, which speaks to your question, Ryan, I think a little bit, because oftentimes we decide, oh, we're just going to pray through it, or we're just going to,
Mm-hmm.
don't do that. We don't need. And so mental illness has become taboo, where
Mm-hmm.
people believe like we don't really need this assistance. But I noticed that more people are getting help now, which is good. I see that a lot of
Yes.
people are coming to the forefront saying, I need help, because these things are manifesting. Suicide is on the rise. People are
Yeah.
taking more fentanyl, and drugs, street drugs are really on the rise. And I think that we need to start looking a little closer at our loved ones, people in our family, because then another
Mm-hmm.
thing that happens when you're dealing with mental illness, from what I've observed, you're mad all the time. You're angry. And everybody that comes into your space, you're angry with them, and you're blaming other people for your problems, when in fact, you just need help. You need to talk to a therapist. You need to talk to someone like Dr. Arlice Cleveland here, who understands how to work and walk you through using tools that have been proven to work to help you get to where you want to go. So, Dr. Arlice, do you feel that mental health is taboo in our communities?
I think there's been a stigma, when it comes to mental health, but also I do think that more people are starting to um, go see therapists, talk to therapists, or learn how. What is it that they can do? The more they become aware that there is an issue, because it's could be trauma, childhood trauma, or something that where they are. I mean, sometimes we're just doing fine in life and we might just get stuck, because we go through those different phases in life, like that's unavoidable, right? So I do think that the more mental health is presented to others and they have that connection and that's that chemistry with that therapist, then it makes it a lot easier for them to start, talking to therapists or trust attending therapy, should I say. Yeah.
Yeah, that word.
Which is major. And let me say this, especially with substance use, right? Substance use,
Mhm.
like if you're recovering, you're going to end up with a therapist, right? Attending group therapy, individual therapy, and hopefully it's a therapist that they feel comfortable with, because it really makes a difference when they can actually start looking to see, like, wait, okay, I am using, and this using is not just because of a situation that just, in some cases, yes, something that probably transpired, but that probably was just something that initiated them to come forward, where they eventually get to look back and say, wait, I've had this stuff going on for a while, and then they can start addressing those issues. But there has been a stigma for sure.
Yes.
Yeah, yeah. I think different ethnicities have their beliefs. When it comes to research, has proven that when it comes to therapy, some believe in only holistic, right? Whole, like instead of saying, okay, yeah, I'm stressed out, they might do what we call like somatic. Oh, my stomach hurt or my back hurt, when really it's anxiety or depression. Certain
Hmm.
ethnicities handle it that way. Some might feel like they might only want to go to a priest, right? But at the end of the day, a therapist can work with anyone from any population or ethnicity, religion, so on. Therapy is needed to help us cope in everyday life, just to keep moving forward.
Yes. And I think,
Yeah.
I'm reminded in October, it made 9 years that my brother shot himself in the heart
Mm.
and he committed suicide. And so, I remember the way my body responded to that. So it doesn't matter how much you think you're in control, your body starts to do things that you never thought your body would do. I literally passed out. I fell on the ground. Like I've never done anything. I'm so in control in most situations. But when that happened, I lost all control. And so therapy is what got me through. Therapy is what helped. I wish he would have gotten therapy, because if I would have known, because then you start blaming yourself. There's so many components to that when
Yeah.
someone does something like that, and they're not here to ask, why did you do that? But I'm
Yes.
convinced that if he would have said something,
Yeah.
shared something, got some help, he'd still be here.
Yeah. And many times that is the case. Like, um, there are times when people will show signs that they're reaching out or crying out for help, and it's common that family members or close friends would blame themselves and say, was he saying this, or I could have did this, or I could have did that, and it wasn't you, you know. Then there are times when people are really good with covering up thoughts of suicide, and so that's why when we started off, we talked about mental health. Like always, mental health is across the board. If people were to stop and think about self care and think about one another and checking in on each other, that's really important, you know. It's very important.
Yes, I was thinking about different, excessive laughter, constant crying, over the top, dressing. All of these things can be signs of a mental health issue.
Giving away things.
Giving away things.
Giving away
Yeah.
things. Right. Making plans and arrangements, things that they wouldn't normally do. But
Mhm.
like I said, some are very good with hiding it
Yes.
too, right? So in most cases, especially when it comes to, family is, they're just family. Like, oh yeah, this is family. Yeah, they're going through that. But some of the stuff that there's never a tolerance level where we could say something, if somebody lost a job or someone got a divorce or a breakup didn't impact that person, like it could be anything. And really checking on that loved one and showing up. Somebody didn't do good, somebody is struggling in school, right? Yeah, someone is struggling in school and probably about to get kicked out of a program, and the expectations, like, it shows up. And it's really important to just be really supportive and mindful of what others, that's close to you are going through too. But a lot of times there are probably cries out for help, they just don't know how, and we don't identify it that way at that time, if that makes sense.
Yeah,
Like, we don't,
because
don't know that this was a cry out for help,
sure,
right?
because we're
We
not
thought
trained.
this,
We're not
right,
trained for that.
exactly,
The average
exactly.
the average person in a family isn't trained to understand that. All that excessive laughter my brother had, I was just laughing with him. I didn't know he was
Mm-hmm.
laughing, trying to cover up pain, because I wasn't trained at that time.
Right.
Now I see things a little different because I've had a lot of training and I've been looking
Yeah.
closer with a magnifying glass. And I
Right.
like what you said, sometimes even just you don't when somebody closes their front door and you go home and they're home alone,
Mm-hmm.
we have no idea what they're experiencing in the privacy of their own home, what type of
Right.
depression kicks in, or why they're not coming out. They're isolating, like you said
Right.
earlier, Dr. Cleveland.
Mm-hmm.
People are isolating, and that can be very dangerous. Yeah.
Yeah.
Yeah. Ryan, what do you say about that?
I was just about to chime in there. For you guys have been mentioning isolation a lot, and I've dealt with different kind of downsides to my own mental health, and I personally feel like it's definitely a different headspace. I feel like when I definitely don't feel like myself. It's definitely a different person. Like earlier, Miss Sharon, when you mentioned like when somebody's feeling that way, they're mad all the time, annoyed all the time. I notice a difference about myself. I am irritated with people. I get irritated very quickly with people. And it gets to the point where I have no emotion in my voice. There's just nothing there. It's like I'm a shell of myself almost. And
Mm-hmm.
the isolation is definitely there 100%. And this kind of made me want to ask, because when I think of it, it's just my negative headspace. That's the only way I can describe it. And I wanted to ask, how would one pull themselves out of that negative headspace, and what are some things they can keep in mind when they find themselves there? Because me, I like to journal a lot. I like to talk about my emotions, and I'm very open with that, so I don't really have an issue with it as much as I did before. But for people who may not have that self-awareness, how would they go about that?
Well, I still go back to go to therapy. Go to therapy, because even though you journal, you still need to process that. If you have the same thing repeating, going around in a circle in your head, then you're not getting new information. You know what I'm saying? It's like if you have a circle, that circle is just continuous. But if you make it a straight line, eventually it's going to get cut off. And you want to find out, where is that coming from?
Oh, that's good. I like that.
Like, really, where is it coming from? It's not just, okay, I feel agitated, I feel frustrated, I feel, there's no voice. Like, that says a lot. There's something there. There's something that's making you feel that way. And so going inside and identifying what's going on with me. Like, what's happening? Did something happen? You know what I'm saying? I'm not asking you that right now, but I'm just saying you want to be able to really take a look at that, because it builds, right? It builds. And it could be something way back from childhood. It could come all the way back from childhood. People will live their lives to get 50, 60, 70, and still, this is me, this is how I am, this is how I'm going to be. And if then don't nobody like it, then they could kiss my beep, and it's not. It's not. It's like you have those signs. And if you're getting those signs, especially, when you're aware of it, it's being able to go to therapy and find out what it is, because it could be something that you just experienced recently, or it could go back to childhood. And most people, they get a little afraid when they hear that back to childhood. My childhood was fine. My parents were great parents. We're not saying nothing about your parents, right? Everybody parents was great parents, right? I grew up in the perfect household, but stuff happens. And it doesn't mean that stuff was intentional, right? It doesn't mean that it was intentional. I'm just going to use an example. I mean, our parents came from a different time. So they were doing different things. There were different laws. There were different rules. There were different ways of discipline. There were different times for females at a certain time, right? We didn't have no rights. And that gets passed from one generation to the next generation to the next generation. And so I'm going there because a lot of times people will find that when they have that, how do I feel about myself? It's easy to say, oh, I love myself, and oh, I'm great, and this is how I'm feeling today. But if it's something that needs to be addressed, where you're isolating, where you're feeling agitated, these are behaviors that are showing up, right? Then that means that you need to talk about it. You need to dissect it. You need to process it with someone who is a professional. And I stress professional because we do have others that we can talk to, but other people are only giving you their opinions or based and what is based off of their life experience, right? Whereas with a therapist, we're not imposing our own values on you, right? We're here to help work with you, to help you process what it is that you're going through in order for you to get to really having that genuine love for self and understanding self. So, yeah, I could say some of the great things is being mindful of automatic negative self-thoughts, right? But if a person really don't know what automatic negative self-thoughts are, and you just complimenting yourself, then it could get mixed in with arrogance. And that's not what we're doing. If I say I am amazing or I love myself, so I love myself enough to know that I need to set boundaries. Or I love myself to know that I can say, you know what, I don't like the color of that, and not be affected or impacted by somebody else's opinion. And it takes work to get to that point, because then you don't feel responsible for somebody else. So there's a big thing to feeling agitated and kind of not wanting to mingle in. And then there are certain personality disorders that might kind of have that behavior. But I'm just saying, for the most part, it's really about working with someone to help you process what you're writing. What are you thinking? Why are you feeling agitated? And having tools to be able to work on.
I like what you say when you talk about, because what happens is the self-talk. You were talking about self-talk, Dr. Cleveland, and you were talking about it manifesting into something else. And I had a visual in my head, like I'm telling myself, I'm beautiful, I'm wonderfully made, I like your eyes, Sharon, I like when you smile. And I'm telling myself all these things, but then that can translate into, now I'm walking around thinking I'm all that, with all these underlying co-occurring issues, right? So I can see how the self-talk is a good thing, but I can also see how it could turn into a negative for you, because then you start coming off. I've heard so many women in my life say, "Oh, I'm better than that." And then they start acting that way, and they're acting out in a way that's not really conducive to getting better. It's it's making you look bad. It's making you look different. And
Right.
I think it's important to put those things in perspective and get the therapy that you're talking about so that you'll know you can get to the root cause. And Ryan, when I look at you, her sister's name is Robin. Hi, Robin. Ryan, when I look at you, I want to know what's coming up for you right now when we're talking about this, because I seen a look on your face. What's coming up?
I'm just sitting here taking notes about everything you guys are kind of talking about, and one of the things that I noted down is that when you said like to stop automatic negative self-thought, yeah, negative
Mhm.
self-thoughts, and then because that's something that I just did on my own. I don't know if I talked about it in the self-care episode, but when I was younger, that was something that I kind of forced myself to start doing, is talking about myself in a more positive light in order to
Mhm.
kind of gain a confidence that I didn't have before. And so I was kind of thinking about it in a way where I've known with my own experience, along with my positive self-talk, I was learning as I went along. Like I was learning that, okay, I can say this about myself, but I also have to confront the fact that I'm not perfect. Like I can say, oh, I'm perfect. Oh, I'm good at this. Oh, I'm good at that. But I have to acknowledge, okay, I'm good at this, but I'm not so good at this. And it's like I'm trying to find a way to word it, but like learning as you go along with it. And it's not just positive self-thought and then not changing anything about what you're doing. It's about having that positive self-talk and then changing, learning, growing as you go along.
That means
Absolutely.
that
And that's
dealing
exactly.
with it. I'm sorry. Go ahead, Dr. Cleveland.
Absolutely, and that's exactly what I meant with having the tools, and working with someone to help you be able to process that, because that goes along with how do I see myself, how do I see the world, how do I see my future, right? So, how we see ourselves and how we see the world, that's how people behave, right? So when you are saying, I am fierce, I am so proud of myself, I am so happy, it's coming from a genuine, compassionate, loving, humble place, right? It's knowing your value, it's knowing, it's having confidence, having self esteem. And when you have that, you don't have to be ugly. I don't have to be ugly to anybody to have confidence or to give myself. I could look at someone else and give them a compliment and be totally sincere about it and keep on going, right? But if someone is saying, "Okay, yeah, I'm all that, and I'm, and this is their attitude, and I have this and I have that," that doesn't it doesn't address whatever real issue is really going on. We're talking about real issues. We're talking about worldview. How do you see the world, right? Because you're in this world, you're a part of this world, you're walking every day, and if you felt agitated, being able to identify, why do I feel agitated right now in this moment? Well, that noise over there might be getting on my nerves. And it's okay that that noise might be getting on your nerves, but you don't want to be able to carry that around every day, all day. And you know, if so, then there's something,
It
you
sounds
know.
like what you're saying is these things need to come from a healthy place.
Yes,
And you get to the healthy place by getting the therapy that you need so that you
absolutely.
can put everything in perspective and speak from a place of understanding of who you are and why these things are coming up for you. Okay, I
Yeah.
think I get it.
And it's so, and this is why I said mental health across the board. I think the same way we go to the regular MD, doctor, gynecologist, dentist, we should do the same for our mental health, because we have so much going on every day in our life, right? Every day. Whether you're a parent, a student, or just, a child at home, it's something. And we're continuously processing everything that we're going through. And if we don't understand how it impacts us each day or each week, and process that and talk about it. And I'm not saying that go to therapy every single day for the rest of your life, but even if it's going to go see a therapist, it starts off from maybe once a week or once every 2 weeks or once a month, right? And then say you get to the point where you're using these tools, you're doing everything that you need to do, but then you get to another point in your life, right? Or even if it's just, but it's just to go back and check in with you, because we go through phases. We go through phases, and life just shows up. Life shows up for us all.
Yeah, you saying that reminded me of we had a different guest. Her name was Jasmine, and that's something that she emphasized a lot, that we go through different seasons in our lives. And I do agree with that. I kind of want that to be once I figure out how. This is also my next question, but once I figure out how and like where to find a therapist, like kind of figuring out how to adjust and find different people who like fit me for that different season in my life. And so my question is, how would someone go about finding the right therapist? And like, is it a long process, or is it something that's just like you know when you know?
You know when you know. I'm going to just put it out there. Maybe there might be somebody that will argue with me, another clinician that might, but you know what? I feel it's chemistry. I feel it's chemistry, because if you're sitting with someone that you don't have that chemistry with, and you don't feel like you're receiving what you need to get from them, then it's not going to work, right? But let's say you're with a therapist that you feel you have that chemistry. Oh, I could tell them anything. And even when the therapists do challenge you, you know that it's really, it's something for you to look at. Oh, they're not just trying to, pick on me, or they're really listening, or we're really working on something. And you might feel some frustration. You might feel like, okay, when things start to happen and you start acting out, because acting out, that mean that the therapy is working, things are getting shucken up, right? Change is happening, and you can actually go back to that therapist and know that you're really with someone where you can just be completely comfortable with. So you just know,
I
right?
think too, I think too with I agree with everything that Dr. Cleveland is saying, but I also believe that when you feel heard, you feel understood, you feel the trust, you feel like, you can really trust this person with everything. Um, they make you feel empowered, like you can actually get something done, you're accomplishing things. And it is. I agree with you, Dr. Cleveland. You just know. Once you feel all of these things, you just know. It's like,
Yes.
okay, I feel the trust, I feel the love, I feel the understanding, I feel the commitment, non-judgmental space. I know that this is the right therapist for me. I agree.
Right. Yeah, absolutely. And that's and it's very important that you feel that. Searching for a therapist, there are so many now programs, like whether it's in person or Zoom, where therapy is offered, as well as for students. Schools refer students to therapists. I know I'm a professor at Pepperdine as well, so we do not only for our students, but it's open for everyone to come and receive therapy, groups and individual therapy as well. So therapy is there, and it's giving it a try. And you sit with that therapist, the first clinician, and if you feel that, if you feel like the it's not there for you, then it's okay. It's not making the therapist feel bad if you switch. This is about you, and it's about you getting what you need, and that's what makes it work. Just like what Sharon said, she just broke it down in terms. I say the chemistry, have the chemistry.
The chemistry is so important, because if I'm sitting with someone and I don't trust them, and
That's
I'm not
right.
authentic, I'm not going to be,
You're wasting your time. Yeah, you're wasting your time. If you go to your therapist and you feel like you can't tell your therapist, and it's important to tell the therapist the truth and tell them everything, right?
then why am I
Because
here? I can't tell you? Why
Right.
am I here?
Otherwise, you're wasting your time. So yeah, absolutely. But
Time and
yeah,
money.
reaching.
Time and money.
Yes, yes, yeah. And many
Yeah.
therapists
Yeah.
do work with sliding scales as well. I would say that. So in person, online, um, and looking past the stigma of seeing a therapist, knowing that, okay, this is about me, because really the stigma is really about what are other people going to think, what are other people going to say, right? And you might find that going to therapy, you'll start looking at them like, oh, they really need some therapy. You go back as a teacher. A lot of my clients or patients that I've had over the years, I end up telling them that, especially whether they're younger than, being the youngest one at home or the oldest, but you go back being a therapist, you go back being a coach without even realizing it. And then people will start asking you because they'll see your change just naturally, not even just with your talk, just who you are. Like, wow, you just seem really, what are you doing? And, oh, I go to therapy. And that changes people's mind when they see you.
Hmm.
And
Mm-hmm.
I think that's really good because not all therapists are going to actually think the same. There are
Mm-hmm.
different approaches, right? Everybody's got a different approach. And when you're in the room with somebody who challenges you, one
Mm-hmm.
person might become very irritated by the challenge, but someone else might think, oh, that challenge is making me think. It's
Mm-hmm.
making me think outside the box. Now I'm thinking about, can I fix that? Is that really what I'm doing? And so being challenged is not necessarily a bad thing, right? But sometimes we act like that. And it depends on how it's delivered and it depends on how
Right.
it's received. So it's
Right.
definitely a partnership, therapist and client, or we could say therapist and patient. It's definitely a partnership. I don't think that we should ever get to the point to where we feel like nobody can help us, but I also believe that it needs to be a good fit.
Yeah. And starting off, also, it's important to find out if you know someone that is looking for therapy. To most people wouldn't think to say okay because they don't know about treatment modalities, but you want to find out what is that therapist's approach. That's really important. What is their approach? Because there are certain treatment modalities where you're challenged throughout the whole time, right? It's like, okay, well, if you don't care, then it doesn't matter. Believe it or not, that's actually a treatment modality, right? Then there are treatment modalities where it's focused on, cognitive behavioral therapy, addressing how we think and our belief system, right? And changing that belief system so that it could change the behavior, right? So looking at that, so you want to find out the therapist's approach. What is your approach? What type of therapy do you do with your clients? What population do you really work with? That's important too. These are questions to really stop and ask because you might get a therapist who is used to only working with substance abuse clients, right? Then you might get a therapist that might be used to working with kids only or couples, right? So it's important to find out what population do you work with? What is your approach? Do you give homework? Do you give tools? There are some therapists who believe in just listening and taking in information and helping you process while you're in the session. I'll tell you, I'm a therapist where you get homework, right? You get homework, you get tools, and that homework looks like tools. It's tools that you're gonna go practice, like you said, journaling. Along with that journaling, let's add some self monitoring. What are you going to look at about yourself? How many times are you going to have this negative thought? How many times do you find yourself in that agitative state, right? And what was triggering? So that's a part of keeping like your diary or what we call like a self monitoring log, right? So you want to make sure that whichever therapist you find, what do they have to offer? And it's okay to ask that. And like I said, it's okay to switch therapists. Any therapist that would be offended something's wrong. And I don't think there's too many therapists that would be offended if you decided that you wanted to, it wasn't a good fit.
Hmm.
Yeah.
I wanted to kind of add on to the journaling aspect. I know that's kind of what I called my own way of expressing my emotions healthily prior to,
Mhm.
I still don't have a therapist, but prior to finding a therapist. Some other things that I did were like drawing or like going outside, exercising, cleaning. Would you say that these are things that can help somebody get out of that state if they needed to?
Yes, absolutely. But like I said, it's good to have someone that a professional, a therapist that you can help process that with, because there are people that go out and go bike ride. Like, of course, those are things that you can do, right? That will keep you active, but you want to have it, you want to address it. You want to address an issue if there's an issue, you know? I mean, some people replace one issue with another one. They might start becoming workaholics, right? Like all of a sudden, or they'll start overeating, or going too far with the create a whole eating disorder, right? Like you want to be able to address it because it could show up in other places in other ways. So you want to be across the board. Some people start riding bikes all the time, and it just like we're hey hello. I mean, but I'm not just discrediting riding a bike or doing any of that. But you really want to go and get some professional help along the way. And
Well,
there
I
are
just had
or
a
brief.
flash. I had a whole flash. That's why I started laughing. I'm so sorry, but I had this flash because I'm a busybody. If I could just stay busy, I don't have to think about nothing. I don't have to
You
worry
don't have to
about
think about it. Right. You don't have to think about it. But then here's the thing, if you sit still, when you get
it.
still, and
That's
if
why I
there's
don't sit still.
right, then it comes up. And for some people might start eating too much. Some people might start not really eating much, right? Um,
How
exercise.
about stop cleaning up? I don't even want to clean up anymore.
Yeah, I mean, to a certain point, some people might get to the point where I don't want to do anything. I'm just here. Okay, I'm here. I'm just gonna, yeah, I'm gonna go. Okay, um, I'll go hang out with everybody, and they're there and they're present. But I mean, yay, hey, yeah, I'm here. But it's really addressing the issue. It's
Yeah.
not just finding ways to avoid. You want to face it. You want to talk about it. You want to be able to do those tools that you named, right? But you want to get to the core of what's going on, of what's happening. That's what it is. Um, yeah, definitely.
It's always interesting to me because this is so good. I mean, I'm so glad that you came on today to talk about this. Because it is good, and we do need to hear these things. And sometimes we have friendships and people in our lives, and we get into these spirals where all we do is sit up and talk all day and gossip about this, gossip about that. But it's really because there's loneliness or there's some underlying issue that hasn't been dealt with, or
Yeah.
misunderstanding. Oh, that's not what I meant. Okay, and then what are you really hearing? So I have a question for you. Do you think that people can hear things that weren't really said and have it take a snowball effect and totally ruin a relationship?
Yes, absolutely.
And where does
Absolutely.
that come from?
Their perspective of things and their worldview and how they see stuff and how they are, who they are, like what their belief system is. It's based off of the belief system, right? Two people, I mean, no matter what, I always say, I don't care if it's twins. If you guys are looking at the same tree and you guys always walk side by side from each other, you still had different experiences somewhere and seeing different things, so you still have your own perspective your own belief system, even if a lot of it might, compare, be equal, and we could say the same thing at the same time, but you know it's their belief system. So, and communication as well, some people are not very effective with communication. So comprehension, understanding, right, and being
Yeah.
able to communicate. Absolutely. So
So
I
that's
think
one
that
reason.
it's mm-hmm.
That's one reason why I don't really like texting, because when you text, it gets so out of context.
Yes.
Because it doesn't have emotion, it doesn't have feelings, and you're texting something, someone receives it on the other end having a bad day, or because we don't know what that other person is experiencing, and then they respond to it. Now we got a problem that we wouldn't have had we been in front of each other.
Absolutely. I'm not a big I'm not one that texting. I don't like texting much. I mean, a little yes and no's, and but a whole, oh goodness, because I know I might mess up on a word or leave out a word, and next thing you know I'm like, oh my goodness, wait, that's a typo. Then I'm typing typo correction with the whole sentence all over again. Yes, it's you're absolutely right. It takes away from the substance, like the content, like communication is so important, and learning how to communicate, that's a part of therapy too. Using
Mm-hmm.
I statements, understanding, hearing, reiterating, reframing what you're saying, what the other person is saying. You know.
Yes, because especially when you're dealing with mental illness, when you're dealing with someone who's already depressed or someone who's already going through something, and one little word, even a yes or a no, can be construed as something like, "What? That's all she got to say?" So,
Right.
it's interesting how we process data and what comes out of it, and it can all be based on your state of mind, your mental.
Belief system. The belief
Mhm.
system, absolutely. You change the belief system, then you change your behavior. You change your response to things, how you see someone else's perspective or other people. Absolutely. How you see yourself. Absolutely.
Yes.
I wanted to
Yes.
go back to what you guys were saying about kind of like misreading and misunderstanding what someone says, maybe over text, or it even could be in
Hmm.
person. Um, I go through this a lot. I text a lot of people all the time. So um, that's something that comes up quite often. And one thing that I've noticed is the communication is a big aspect. That's a big part of it. And being able to ask, hey, did you mean this? Or like if you took it the
Hmm.
wrong way, maybe take a step back, think about it, think it over, and then come back with a fresh mind, a fresh perspective. Hey, can we talk about this? I kind of took this, I think I might have taken this the wrong way. What did you mean by that? That's something that I've kind of taken into my own life and kind of learned. Maybe I need to be more open when I'm talking to people over text. And it's like you send a message, you have, for me, I don't use punctuation when I'm talking with my friends, so it makes it feel like more upbeat, more personal. And when I use punctuation, everybody's like, "Are you okay? Are you mad at me?" So
Yeah.
it's it's just about knowing who you're talking to and kind of being open and vulnerable enough to ask questions. Ask, "Did you mean that?"
Right. That's so true, Ryan. I mean, it's good that you practice that, but there's a lot of people that when it comes to communication, are being able to own or take accountability, or a lot of people don't have those skills, and unfortunately, I mean, it comes from the belief system. It comes from what they're accustomed to, what they've been around, right? um, Social environment, etc., right, the
Or what
family
they're going
system.
through at the moment, what they may be experiencing
Hmm.
in that moment. It doesn't necessarily mean that it has anything to do with what you're saying. They're
Right.
processing it based on something in their own head. And we
That's
have
the
to be
belief.
very
Yeah.
careful with that.
Yeah, that's their belief. It's like you're looking like, how did you get to? Well, no, what I was trying to say was, I mean, but you know, so yeah, and some people, and that's how they function through life, right? And they might see this show up in so many different places of their life. and still don't see, why do I have a problem over here? Why did I have a problem over here? Why did I have a problem back here? Because they're carrying that, and it happens, and it just showed up, with you. So yeah.
Yeah,
Mm-hmm.
that's good stuff. Good stuff. Ryan, I really like what you said about how you take, responsibility for your texting and trying to make sure. And I think it's good to always go back and ask questions and to have that dialogue. But sometimes when you're dealing with someone who doesn't want to talk about it, because I believe I have a pretty good heart, and I believe you two have a pretty good heart. But
Yeah.
at the end of the day, you can piss anybody off at any given moment. And you're like, Ryan would never do that. Dr. Cleveland, nah. Sharon, nah. But it's how people receive it, how they process it, how your delivery was. And so one of the things that I try to go back to, if you say something to offend me, I go back to, well, that's Dr. Cleveland. She wouldn't try to hurt me intentionally. Let me have a conversation. Oh, Ryan is a sweetheart. Ryan wouldn't do that. So what is it that happens that causes you to take it all the way to, I don't want to be your friend anymore. I don't want to deal with you anymore. You just piss me off. When you've known this person for many, many years, and all of a sudden something happened and it's like, I'm done. That's happened to me 3 times this year in the last 12 months.
It can be something that people are going through, something that they've been going through, something that um, could be festering, something they never communicated, right? You have people that will hold things in and just take it in, not say anything, right? Um, that's really broad because it says a lot about a person's personality. And then once again, we go through phases. And I don't mean just phases like situations in our life. I mean literally phases. So we start changing. Stuff changes in our life. So it changes our perspective. It changes the belief system, what a person go through. That means that the tolerance level might be a little different. Um, a lot of times, kind of touching on what Ryan said, like having certain tools that she practiced, right? At certain point, there might have been a certain point in your life or their life where they were practicing something that was really working for a long time. They done forgot about it and gone on to another phase in their life. And now they're in this moment, at this time. Mm-hmm. So it could be various factors to that.
It just depends. Well, this has been a great conversation. I don't know what y'all think, but I think this has been really worthwhile. I think it's something that people can draw from and maybe pick up something and begin to change their lives, because these are life-changing conversations. And I know we could talk about this all night. Ryan, do you have something else you want to ask before we get ready to wrap it up?
Yeah, actually. So prior to our episode, I asked Arlice to create a hashtag, a word or phrase that she keeps in mind when she thinks about mental health. Now, Dr. Cleveland, would you mind sharing with us your hashtag life lesson?
Life be life, and it shows up for everybody. So, do plenty of self-care.
Plenty of self-care?
Yes. Plenty of self-care.
I like that. And I would like to share, if you're in the United States of America and you're having a crisis, there is a phone number you can dial. It's 3 numbers, 988. Call 988 if you feel like you're in a suicidal crisis or any kind of crisis for that matter. Don't do it alone. Don't sit at home going through trauma alone. Get help. Dr. Cleveland so eloquently put it earlier. Everybody needs a therapist. Everybody needs help. And forget about the stigma. Forget about people thinking you're crazy. Get help. Get help right away.
Can I add one more thing? The great thing about a therapist also is confidentiality. You share with us, and it's with us. It's with us.
Beautifully put.
Thank you so much, Dr. Cleveland, for your time. Thank you, Ryan, for waiting on us to get it together tonight. You are always a great host, and I really appreciate all that you do. Thank you.
Of course. Thank you guys so much for coming on. Thank you, Dr. Cleveland, again. Your insight today was beautiful. It really did teach me a lot, and it drilled one thing in me. Therapy, therapy, therapy. Get a therapist, find therapy, get therapy.
Yeah.
Now, don't wait. Thank you guys. Have a good night, and we'll see you
Good
for our
night.
next episode.
Of course, we'll see you next week where we'll be talking about different relationships in one's life. I'm Ryan Green.
And I'm Sharon Mackey, founder and CEO and co-host.
We thank you so much for listening.
Okay,
Bye.
bye-bye.